my name is Evelyn, and this is an abdominal assessment of an 18-year-old male. He's already denied any GI problems or issues, no history of any GI complaints, and denies pain. Okay, so starting with inspection, if you could just lay down. So I'm looking for symmetry, I'm looking for skin color, I'm noticing there's no jaundice, I'm looking at venous return patterns, and I actually can't visualize any veins on the abdomen, so that's a good sign. And there's no lesions present as well. And I'm also looking for any pulsations, and again, just making sure everything is symmetrical. Okay, so moving on to auscultation, I'm going to auscultate all 4 quadrants, beginning in the lower left, the lower right quadrant. And I'm listening for clicks and gurgles, vowel sounds. There should be 5 to 15 per minute in each quadrant. I'm listening for a full minute in each quadrant. And vowel sounds are normal active. I'm also going to listen over the spleen. Listening for any friction rubs. I'm going to do the same thing over the liver. And I don't hear any friction rubs. I'm also going to listen to the renal arteries. And I do not hear a bruit in those. And then also the iliac arteries. And no bruit. And I can also listen to the femoral arteries. I'm just making sure there's no bruits. Okay, and moving on, we're going to percuss. So you just let me know if it's ever tender when I'm doing this, okay? And what I'm looking for is tympany over all 4 quadrants, which we do have. Okay, and then I'm going to percuss this for the spleen. I'm going to start in the intercostal spaces. And there is an area of dullness between the 9th and 10th intercostal space. A very small area, which is a normal finding, so the spleen is not enlarged. And now I'm going to estimate the liver size. So I'm going to percuss up from the midclavicular line. I'm hearing tympany, and it changes to dullness. And I'm going to mark where I hear dullness. And then starting at the umbilicus, I'm going to percuss up to where I hear dullness, and then I'll mark that as well. And then starting the midclavicular line, percussing down, resonance to dullness. And then that's going to give me the upper border. And then same thing closer to midline. Okay, great. And then with a measure, I'm just going to measure where I marked, and it's approximately 7 centimeters. So that's a normal finding, so the liver is not enlarged. So now, after we're done with percussion and we've estimated the liver size and the spleen size, I'm just going to do light palpation over all 4 quadrants. I'm feeling for any masses. Let me know if there's any tenderness. Things are symmetrical, noticing the texture of the skin. And again, there's no masses found. So now I'm going to move on to deep palpation. So I'm just feeling for any deeper masses. I'm feeling the border of the liver when I'm in the upper right quadrant, and it is about where I've marked it. If you could take a deep breath in, and the border of the liver, you can exhale. So the border of the liver goes up about 2 to 3 centimeters on inhalation. And then deep palpation, I'm feeling if the spleen is below the intercostal spaces, which it is not. And then masses in the lower left quadrant may be normal. It may be stool in the colon, but I don't feel any. And no areas of tenderness?
No.
Okay. And then I'm also going to feel for the aorta. And it's not enlarged, so and I don't feel any pulsation, so that's good. And also around the umbilicus for any hernia. Okay, and then I'm going to have you sit up. Okay, and you let me know if this is tender. So I'm just putting some, knocking on the kidneys a little bit. Any of that tender?
No.
Okay, and then I'm going to deeply palpate for the kidneys. If you could just sit up and kind of take a breath in. Okay. And the kidneys are not palpable, which is a normal finding. So that concludes the abdominal assessment. Thank you.